Ladies and gentlemen, we will announce that we will be starting part two of our House Health Subcommittee momentarily. If members of our House Health Subcommittee could make their way to House Hearing Room 1, we will begin our calendar momentarily. Good afternoon, ladies and gentlemen, and welcome to a continuation of the Tuesday, March 19th, 2024 House Health Subcommittee. It is Wednesday afternoon, as we had mentioned in full health committee and in this committee as well, that we would be continuing as diligently as we can for as long as we can to work through as many bills. This committee does have a hard stop at 5 o'clock. Several members have to have another obligation at 5 o'clock, so we will try to work through as many bills as we possibly can in the time frame that is given to us. Ms. Adams, if you could please call the roll.
Representative Hicks. Here. Jernigan. Yep. Leatherwood.
Here.
Martin. Here. Mitchell. Here. Sherrill.
Here.
Terry.
Here.
Williams. Representative Hawk.
I'm here.
You have a quorum.
Chair detects quorum. We will move forward with business. Any personal orders before we begin? Seeing none, as you'll recall, we ended yesterday with a recess that had us on item number 21, House Bill 2497 by Chairman Hurt. Chairman Hurt has not morphed into another person, but Chairman Hicks has signed on to the piece of legislation and is knowledgeable about the bill that is before us now. And Chairman Hicks will be recognized momentarily. We still are working off our list of potential witnesses from yesterday, if need be, if by chance we do need to go into recess at any point in time. Chairman Hicks, you are recognized on House Bill 2497. Do we have a motion? We have a motion. We have a second. I believe the posture continues to have the amendment drafted code 15303. The bill, that amendment has been voted, and we are considering the bill as amended. You're recognized, Chairman Hicks.
Thank you, Mr. Chairman. And I have big shoes to fill today, but we'll go at it and do the best that we can. So I think that we had the speakers yesterday. We had few questions, but I think we have a few more questions. But I am filling in, so I'll remind, just like Representative Jernigan said yesterday, please no questions. So remember that, sir. But I'll be happy to stand for questions in what I can.
All right. Thank you. Do we have any questions where we left off yesterday about the piece of legislation, House Bill 2497 as amended?
Yep.
Chairman Jernigan, you're recognized, sir.
Thank you. And Chairman, I had an opportunity to look over this some more last night, and this is a pilot program, correct?
Thank you, Mr. Chairman. It is a pilot
is.
program.
Typically, pilot programs have an end date, and I don't see an end date in the bill anywhere. My question to you, is there an end date to this pilot program?
You recognized.
Thank you, Mr. Chairman. Could we go out of session and ask legal that question, please, sir?
Certainly. All right, we are out of session. If we could recognize legal staff, if you could please tell us who you are and answer the question.
Caroline Miller, Office of Legal Services. I do not see like a traditional pilot program end date in this legislation. I think there is an application deadline by which applications should be completed. Other than that, I don't see an end date to the program.
Chairman Jernigan.
Thank you. I do have another question for legal on another topic. Would it be appropriate, Chairman, for me to ask the sponsor the question, which I think he'll probably just go back to legal again, or do you want me to ask legal the question now?
Why don't you go ahead and ask legal the question now? I think that'll save us about 3 minutes.
Okay. The second part is it's about having a DIDS is going to be licensing this community. And Chairman, as you know, when they closed Greenville, that was the last institution where we had a congregated setting. We became the 16th state in the nation to be congregation free. And that was because of Olmsted and the violation of the ADA. Since we're licensing this, and after speaking with DIDS and their counsel and the AG's opinion, is that this is also a violation of Olmsted, because when they do license it, the state is recognizing this community as congregated. So my question to legal is, what's your opinion on whether this violates Olmsted and the ADA?
You recognize Ms. Miller?
Sure. I guess I can give you what the Olmsted case says, and it would not be my place to opine on what a court would say about how this statute fits within the Olmsted case. But let me look through my notes. Okay, so Title II of the Americans with Disabilities Act prohibits discrimination based on disability in the provision of public services by governmental entities. The regulations that implement the ADA's discrimination prohibition require that public entities administer services, programs, and activities in the most integrated setting appropriate to the needs of qualified individuals with disabilities, and make reasonable modifications in policies, practices, and procedures as necessary to avoid discrimination on the basis of disability. The United States Supreme Court has determined that unjustified institutional isolations of persons with disabilities is a form of discrimination based on disability and is prohibited by the ADA, according to the Olmsted case. Accordingly, Title II of the ADA requires states to provide community-based placements for individuals with disabilities. When their treatment professionals determine that community placement is appropriate, the affected individual does not oppose community placement, and the placement can be reasonably accommodated, taking into account the resources available to the state and the needs of others with disabilities. That is how the Supreme Court has interpreted.
Chairman Jernigan.
That's fine. Yeah, Title II is to be in the least restrictive environment possible, and it would violate the integration policy. So I'm good with my question is back to the sponsor. So unless there's any more questions for legal.
Chairman Williams, you're recognized for a legal question.
Yes, thank
You're
you.
recognized.
Thank you, Counselor. Of course, I don't have it in front of me, but I listened to you read it. But in the current state statute, it allows for this type of living as long as those properties were 500 yards separated from one another. My question would be if there were no other houses between those 500 yards, would that mean that it is a campus? For instance, I asked the person who was concerned about this bill at the last committee meeting if someone owned 10 miles of road frontage and built a residential unit every 500 yards, it would meet the current statute. Based upon that interpretation, I would think that it also met the homestead. Would you agree with that as well, or no?
Ms. Miller.
I guess that would be a question of a court would likely look at the integration mandate in the Olmsted decision, which emphasizes the right of individuals with disabilities to receive services in the most integrated setting appropriate to their needs, meaning that an individual should have the opportunity to live, work, and participate in their communities to the fullest extent possible. So, I mean, it's I guess a situational basis.
Thank you, Council.
Thank you. Any further questions while we're out of session? Seeing none, we will go back into session. Chairman Hicks.
So,
Sure, excuse me, Chairman Jernigan, you're
all
recognized.
right, thank you. So why can't we work in the confines of the current law that's there now and it's been offered to the community to be integrated? We have ECF, which is Employment Community First. We have Choices Program. We have programs that can integrate these folks with disabilities into a home that have 24-hour care. Why can't we use that model with this community instead of just being the way it's set up now?
You recognize Chairman Hicks.
Thank you, Mr. Chairman. I think it's apparent that this is a pilot program that is set up to be a pilot program. It's going to be more of a development. I've been down here long enough to see that a lot of times whenever government makes a decision, they draw a line and they go completely on the other side of the line. And whenever things go to another side of the line, I'm not sure that everybody is equipped to be on that side of the line. I believe that then we have set up another system that doesn't serve everyone. So I think this pilot program will set up a way to give some freedom to some folks that needs to try something new. This is private, completely private money, okay? This is a pilot program. This is going to be set up in 2 areas of the state that probably needs it the worst, okay? And I think that we'll learn a lot from this. I know that certain folks doesn't want to creep back across that line. I can understand that to a certain extent. But I also believe that we have to serve everyone. And I'm just not sure that in this case, I think this is a great idea. I think this is a new, innovative way of thinking. And I truly believe that we need to try this program.
Well,
Chairman Jernigan, you
thank
recognize.
you. Yeah, the line has been drawn, and the U.S. Supreme Court has said that it's unconstitutional. You say it's a pilot program, but I don't see an end date. You're constructing homes on a pilot program. That's investing a lot of money. To me, that seems to think this program is going to be around for a while. Because traditionally, and would you not say that pilot programs usually have a sunset?
You recognized.
Thank you,
Chairman
Mr.
Hicks.
Chairman. This is a designated development that this pilot program is for these two small developments is what this is for. That is the pilot program. After that, there will be no more pilot programs moving forward until it goes through this legislature. So it is constrained to these two developments, and that is the pilot program. If you put an end date on it, there is a possibility that the development won't be finished. So I believe that's that's where this started, and that's how this is designed to be.
Thank you, Chairman. I will interject at the moment.
Okay.
There are provisions, there are reporting provisions throughout the legislation that begin no later than July 31 of the year 2026 and continue annually for the next 5 years. There are reporting mechanisms that will give information to both this committee as well as Senate committees to discern, is this project working? Is this pilot project working, doing what it is intended to do? Or are we going down the slope that you have mentioned, Chairman Jernigan? You recognize Chairman Jernigan.
Well, I think that there are programs in place in current law that could work in this kind of, if this was private pay, like you say it is, and it's private, and they wanted to do it on their own. But you're asking DIDS to come in and to give the license, and you're asking the state to come in to oversee. And when you do that, it takes it to another level to where the state is recognizing a community that's not integrated. So I'm not going to be a dead horse, and I won't be in favor of this, but thank you, sir.
Chairman Terry, you're recognized.
Thank you, and thanks to the sponsor. Could you help me on this? I'm trying to determine on the fiscal note on the dashboard. It says not significant, but then I'm seeing a fiscal note of increased state revenue of about 22,000, but increased state expenditures of almost $1 million. Can you walk me through that? I'm trying to find out exactly what the fiscal note is on this bill.
Recognized.
Thank you,
Chairman Hicks.
Mr. Chairman. I think I'm aware that most of the fiscal note comes from the department suggests that they may have to hire some folks to be able to run the program, which is a little odd to say the least. So I would hope that we could work on the fiscal note. That's the goal of staff to be able to do this. So I would hope that we could work on the fiscal note. We just.
Chairman Terry.
Okay, so it's you think it's staff and not like physical buildings for the pilot?
Again, at this point, I'll interject the chairman as well. The fiscal note includes titles for IDD Program Specialist number 3. There are 12 positions at $769,744. There are 2 positions for IDD Investigator 2, which will culminate in $170,000, $514. The total being a fiscal note of $940,000, $940,258 that will be for 12 employees in DIDD to handle the thought of the number of individuals to be overseen at this location.
Thank you.
And I serve on the finance committee as well, and this is one of those issues where do we decide public policy in this or fiscal policy? I'm comfortable discerning the public policy on this particular issue, and I will editorial. Well, I'm going to go to Chairman Williams first before I jump in on that. So, Chairman Williams, you're recognized.
Thank you, Chairman. I appreciate the committee's thoughtful conversation regarding this, and wouldn't want to do anything to roll back the clock to go back to the days where we weren't doing things the right way. I think knowing the hearts of men and women in this committee, in this body, I know that no one would really want to do that. But I do, the current statute, as I mentioned before, does allow for multiple of these facilities as long as the distance applies. This pilot program would only reduce the distance limit. It wouldn't change anything about current state statute. The fiscal note associated with the bill is simply the administration or the department's desire to make sure that it's overseen as it relates to inspections, of which are currently done and currently part of practice for all these institutions. I will say I appreciate the sponsor picking up this bill from yesterday, but I know it's really important for us to do this because the previous bill sponsor, who was unable to be here today, I had a great opportunity to spend time with he and his wife, Dawn, and their special needs son, Thornton. When Chris came to this body, he didn't need readers or a thing around the back of his head to hold his glasses on. So this place has a tendency to age us. And I can't imagine what Dawn and Chris Hurt are thinking as it relates to the care for Thornton. But what this bill is differently is that it allows for parents, aging parents particularly, who are wanting to find a better option to care for their special needs loved one in a time in which they're gone. If like we were doing with mental health and substance abuse, where we just go in and buy a house and throw 4 recovering patients in there in the community and there was no oversight, this is completely different. There are house parents to stay there with them, much like we have in our children's homes for kids who are looking for adoption in my community. And so I think this is a really good solution. There are things I think, Chairman, we can and sponsor that I think we can do to improve it, to ease those concerns. For instance, one of those might be, because this is a pilot, it is limited to 2 locations, to limit the number of people that they can do it on, so it's more of a family or neighborhood type setting instead of them being segregated, because we know when people with disabilities have others to spend time with them, it's nothing but positive. And so I think, yes, there are some fiscal implications. Some I would argue are a little overburdensome in this instance. I look forward to supporting this bill. I think it's a good opportunity for those folks who can have the resources to provide through a living trust for their families. And so I appreciate the bill, and I look forward to supporting it.
Thank you, Representative Mitchell. You're recognized.
Yeah, thank you, Mr. Chair. And with the fiscal note, you said there was 2 investigators. And Chairman, I don't know if you're familiar enough with current law. How often are these places, does an investigator come and inspect?
Chairman Higgs.
Thank you, Mr. Chairman. Annually.
Annually. Well, I'd be much more comfortable with this coming out of this committee before we voted on in full committee, that went from annually to probably, I'd be much more comfortable with quarterly on this pilot project with inspection, since as the previous speaker, Representative Williams said, we're not going to go back. I don't think anybody on this committee wants to go back, but I've I've talked with the supporters of this legislation, and I've got several people in my district, they're aging and they're just like, what are we going to do with our child when we're gone? They have no other family members. They have no other solutions. But I don't want to go back to where we were. And I just think we need to have more safeguards than ever in something like this. And I'd love for, you to work and try to let's increase those inspections or something before if it gets out of here and comes to full. Thanks.
Chairman Jernigan.
I'm sorry. And to Chairman Williams' comment, when he talks about being able to interact with other folks, they're interacting with other people with disabilities and the staff. They're not interacting or integrating with other folks at night. And that's that bothers me. And there is current programs in place today to be able to place folks and 24-hour care into a home. It's integrated through whether it's Choices or ECF. So there are current laws and options out there. That's my only point. And all right, I'm done. I'll wait for your commentary, Chairman.
I may not come back to you after I say something. You never know how that's going to go. I made some comments yesterday in subcommittee, and I was fortunate to speak and give testimony in 2014 a judicial case in front of Judge Kevin Sharp, and we talked about this, and the state was given quite broad latitude to decide what direction they would go, and I argued in favor of choice for the family, and that care in the nature of what we're seeing being proposed through this legislation is a choice. That is a choice for families to be able to put their loved ones, once they discern and once they see this is where I'm comfortable with my loved one spending a predominant amount of their time, they're able to make that choice. This is a private pay facility. This is an area, this is a place where folks are trusting that their loved one is going to be cared for. And they're going to be coming and visiting. They're not going to be there just dropping them off and sight unseen. There's going to be folks that are going to be paying attention to what's going on. I feel comfortable at the moment with the number of inspections that we do have. I feel comfortable with this being a choice for families to place their loved ones to have the care that they deem and they feel comfortable with for the rest of their lives or for a substantial portion of their lives. If not, then there's opportunity to have that choice to pick up and move. And that's how this particular facility is described to me. And I have a great level of comfort with that going forward. Any further questions or comments? Seeing none. Representative Mitchell.
Yeah, Mr. Chairman, and I just want to get some clarification from the sponsor. Would you be willing to work to do more inspections than the yearly?
Thank you, Mr. Chairman.
You're
My
recognized.
goal is to get this through this committee today, and then the sponsor will work.
Yeah, okay.
He would have to answer that.
Okay, all right. Thanks.
And I will address the fiscal note to a degree. If we're hiring 12 new individuals for this specific piece of legislation, I'm guessing 12 people are going to be doing more than just something once a year. There's going to be active supervision that's going to be going on. We would be investing $940,000 in something with 12 individuals. We're not going to be blind-eyed on this process. Last speaker is Representative Chairman Williams.
I think it's of note, Chairman, your comments are correct as it relates to those reviews, which is why when the original bill sponsor comes back, I hope to communicate with him about a cap of the number of participants, because that would also determine the number of review and the number of people that we're actually serving there, so that cap would give us the opportunity to have make sure that it hasn't grown to a point which would make us all uncomfortable, but it would also help better understand what the review process would look like. And so, Chairman, I think that's a great idea, and I appreciate the committee's discussion on it.
Thank you. And I apologize. I used incorrect terms. I said facility. This is a home. And that's my mistake. And I apologize. I apologize. I did not choose my words wisely, and I apologize. This is a home. So I apologize. Are you ready to vote? All those in favor of sending House Bill 2497 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. No. If you choose to vote no, please let Ms. Adams know of your no vote. Your bill receives affirmative vote. It moves forward to full committee.
Thank you, Chairman. Thank you, committee.
Thank you. As we left committee yesterday, subcommittee yesterday, we had mentioned that when Representative Martin got back into the room, we were going to go back to item number 7 on our calendar. Little did he know it was going to be tomorrow when he got back into the room, but we're going to go back to item number 7 on our calendars, House Bill 2545. You have a motion, you have a second. You're recognized, sir.
Thank you. Here, also have an amendment with the bill.
We have Drafting Code Amendment 015114. Does that show with you?
That's
Okay.
correct.
You have a motion, you have a second on that. Let's go ahead and get that amendment on the bill as we move forward. All those in favor of placing Amendment Drafting Code 015114 on the bill, please signify by saying aye. Aye. Any opposed? Please say no. The ayes have it. Your bill is amended. You're recognized, sir.
Thank you, Chairman and Committee. This is the Tennessee Medical Laboratory Act, tailored to bolster support to rural hospital laboratories. There are several different instances in here where we're going to work to strengthen rural health care. One of that aspects being helping to better define what a rural hospital-based laboratory is. So it specifically includes those within licensed rural hospitals, licensing and accountability flexibility. So this would help just make sure practice measurements that align with federal standards, ensuring that our hospitals meet national qualified benchmarks. Third portion of this would be amending section 6829.111, where we're enabling technical laboratory supervisors to oversee up to 5 hospital-based labs. This better aligns with federal guidelines and addresses the dire need for experienced lab leadership in our rural healthcare settings. This change has been made in request of the College of American Pathologists, the TMA, Lab Board, Department of Health. Rural hospitals have all been working on language to make sure this fits their need. With that, I stand ready for question.
All right. Thank you. Ladies and gentlemen, you've heard a description of House Bill 2545. Any questions or comments for the sponsor? Seeing none, you ready to vote? All those in favor of sending House Bill 2545 to full health committee as amended, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you.
Thank you. Now we are going to go to item number 13 on our calendars. Chairman Hicks, are you comfortable to work from your desk on item number 13, House Bill 2060?
I am.
Chairman Williams, you're recognized for a moment.
Yes, Chairman. I just know, we were just talking, we didn't know what order we were going to go in, but after this bill, I did notice there are some people who probably might want to make a dinner that are not going to be stuck to their chairs today like we are. And I'm just, maybe on the next bill, we can grab a couple of those if we can.
Thank you. And point well taken.
Thank you.
I think we, and thank you, Chairman Williams. Appreciate that. We have gone several bills to the heel. These are some that we had had some amendments that were untimely filed yesterday that are now timely filed. So we are going to knock out a couple of these early and then go back to where we were, item number 22. And we'll try to look at those in the audience and pay attention to who we have with us and go forward there, Chairman.
Thank you, Chairman. Appreciate just a mild suggestion with the will of the chairman.
Thank you very much. We're now calling up item number 13, House Bill 2060. We have a motion and we have a second. On our dashboard, we have an amendment with drafting code sure we've got amendment drafting code is 015859. Is that accurate?
That is correct, Mr. Chairman.
All right, you've got a motion and we've got a second on that. Let's go ahead and place that amendatory language on the bill. All those in favor of placing amendment drafting code 015859 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended. Chairman Hicks, you are recognized, sir.
Thank you, Mr. Chairman. Currently, under Tennessee law, community mental health centers and federally qualified health centers are allowed to utilize employed nurse practitioners and physician's assistants to prescribe buprenorphine to patients struggling with addiction. Their current limits are 4 MPs and PAs per employed physician supervisor and a maximum of 50 patients per. This legislation increases the number from 4 to 5, the number of nurse practitioners and physician assistants that any physician can supervise. This legislation also increases from 50 to 100 the max number of patients each MP and PA can treat. This legislation allows for mono products to be prescribed by the MP and PA when a patient is pregnant or if there is a documented instance of allergic reaction. This legislation exempts CMHCs and FQHCs from requirement to register as an OBOT, office-based opioid treatment facility. This legislation requires to prescribe in this setting that the facility must be in the 10-care Be Smart program, which is very important. So that's the legislation. I'll be happy to answer any questions.
Thank you. And I believe we did get to the magic number was 5, up from 4 individual prescribers. I do believe that's the magic number, sir.
That is correct, Chairman.
Okay.
Thank you.
All right, thank you. Any questions or comments for the sponsor? Are you ready to vote? All those in favor of sending House Bill 2060 to full Health Committee as amended, please signify by saying aye. Aye. Any opposed, please say no. Your bill moves forward as amended.
Thank you, Mr. Chairman. Thank you, committee.
Thank you. Item number 14, we had some discussion about item number 14 yesterday as well. And I think Chairman Hicks, you wanted to make a statement or two on item number 14, House Bill 2941. You're recognized, sir.
Thank you, Mr. Chairman. And yes, we're going to get with the department and work through this. And I think it's not moving in the Senate. So I wish to take this off notice at this time.
Okay. Without objection, House Bill 2941 has been taken off notice. See no objection, the bill is off notice. We are now going to go to item number 16, House Bill 2232. You have a motion? You have a second. Representative Freeman, I think we had disposed of one of your items, item number 17, yesterday and moved it forward. You were fortunate enough to have moved that bill forward yesterday. We're now, and I think similar posture, we had a late filed amendment that is going to come to us.
Yes, Mr. Chairman,
Could you please give us,
drafting code 16094.
we have a motion, we have a second on amendment drafting code 016094, which essentially creates a task study
Yes, sir.
on this particular issue.
Yes, sir.
Ladies and gentlemen, I'm comfortable placing this amendment on the bill. If you are, we have a motion and we have a second on amendment drafting code 016094. Let's go ahead and get that on the bill if we so choose. All those in favor of placing this amendment on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended and you're recognized on the bill, sir.
Thank you, Mr. Chairman and committee. What this bill aims to do is create or to ask TASCR to do a study to understand the current makeup of childcare workers in our state, and then establish a feasibility program to understand what it would look like if we covered the cost of childcare workers' childcare, assuming they meet certain conditions, and study the impact of the benefits cliff. And with that, I stand ready to answer any questions.
Thank you. Chairman Williams, you're recognized.
Thank you, Representative Freeman. Appreciate this bill. I don't know if you're aware, we, in finance sub today, we had a similar TASER bill that I'm carrying as a member of TASER that studies the child care issues across the state. I know that your senator is very passionate about this bill and the study, as so am I. We're already there. As you may know, we as a member of TASER and a member of this body, sometimes in finance, we send all studies to a TASER study calendar, and then we try to kind of pilfer through those to make sure that we're able to give studies to TASER that they can actually get to in a timely fashion. The subject matter and scope of your TASER study and the one that's already in finance sub are very similar. And I didn't know, since we hadn't gotten to that bill yet, if you might be amenable to it, you and I could possibly work on some language to try to marry the two. So Dr. Lippard and his staff, who work diligently to study these things, would be able to study both of those together. Sure. And so I don't want to impugn your bill today, but after today, maybe you and I can get together and see what the differing parts of our language are. So instead of sending two very similar studies to TASER, we'd send one that answers both questions. So just hope you'd be able to.
Thank you, Chairman Williams. For response, Representative Freeman.
That's a great idea. I was going to offer you the same thing. I'm kidding. I think that's great. I think any way we can solve this problem, I don't care how we do it, as long as the problem gets solved. So,
thank you, and thank you. That's teamwork makes the dream work. So thank you all very much for having that conversation in a very transparent way. Question has been called. All those in favor of sending House Bill 2232 to full Health Committee as amended, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman and Committee. Thanks for seeing me early.
You're welcome. We'll take a moment to take an action. An email came to us back on item number one on our calendar. House Bill 2899. The request has been to take this bill off notice. Seeing no objection, once again, item number one, House Bill 2899 will be taken off notice without objection. All right. We are now going forward back to item number 22. So we are back on our traditional calendar as we are going forward. Item number 22, House Bill 2269. We have some amendatory language that is being worked on this particular piece of legislation. So we will roll this bill to the heel. Seeing no objection, item number 22, House Bill 2269 will be rolled to the heel. We are now on item number 23. Item number 23 on our calendar, waiting patiently in the crowd. Chair Lady Helton Haynes. Item number 2378. Do we have a motion? We have a motion. You have a second. You're recognized. And I think, much like some other bills, we're working on some amendatory language here as well, Chair Lady.
Yes, we are. I do have an untimely amendment if you're willing to take that up.
Okay. Let me hope, forgive me, Chairman. Well, give me those comments one more time.
I do have an untimely filed amendment, if
Okay.
you would be willing to take that up.
Yes, Chair Lady, we do have that, and I think it's essentially the same as the amendment that we were considering as well. In your dashboard, ladies and gentlemen, you will find amendment drafting code 016951. Is that the amendment
That's
that you have?
correct.
Okay.
It is.
And that's essentially dealing with the Board of Nursing and some requests for the Tennessee Board of Regents much like a bill we had earlier for higher ed in this committee as well. So
That's correct.
comfortable to accept that, and we'll put that before the committee. Do we have a motion on? We have a motion. We have a second. Ladies and gentlemen, we are voting to adopt amendment drafting code 016951. All those in favor, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended now for description. You recognize House Bill 2378 as amended, Chair Lady.
Thank you, Mr. Chairman. This requires the Board of Nursing to prescribe a minimum of 1,296 clock hours or an equivalent number of credit hours for practical nursing programs offered by a public institution of higher education in the state. The federal government recently issued new regulations that go into effect July 1st of 2024 that will impact federal Title IV financial aid eligibility for students in LPN programs across the state. The new federal regulation states that if a college offers a program in a length longer than the minimum set by a state statute or regulatory board, then the entire program no longer qualifies for any federal Title IV financial aid. This change will impact all of the LPN programs operated by our TCATs. TBR's LPN programs are 1,296 hours in length, and the current minimum number of required hours set by the Tennessee Board of Nursing is 980 hours. This legislation simply sets in statute that LPN programs offered by public institutions of higher education must require a minimum of 1,296 hours. Private institutions will still be able to maintain their current curriculum lengths in accordance with the Board of Nursing's rules. And with that, I stand for questions.
Thank you. You've heard the description. Any questions or comments for the sponsor? Question has been called. All those in favor of sending House Bill 2378 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman
you.
and Committee.
You also have item number 24. Is that one we're still working on, Chair Lady, or is that something that we've got amendatory language?
I believe the amendment is on the bill.
All right.
Or I believe that it's already ready.
Okay. We'll
It's
call up.
015743.
Okay. We have a motion. We're calling up item number 24, House Bill 2650. You have a motion. You have a second. We also have an amendment as was described, or as the number was given, 015743. You have a motion. You have a second. You have a motion to, let's go ahead and adopt this amendment and talk on the bill as fully amended. All those in favor of placing drafting code amendment 015743 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill is amended for description. You recognize, Chair Lady.
Thank you, Mr. Chairman. This legislation improves the Tennessee Health Facilities Commission's ability to regulate nursing homes and assisted care living facilities. Drafted in collaboration between the HFC and the Tennessee Healthcare Association, it allows for more regulatory flexibility and swiftness without diminishing quality standards of patient care. This bill also incorporates cleanup that became necessary when the Board for Licensing Healthcare Facilities and the Health Services and Development Agency merged in 2022. All stakeholders are in agreement, and this cleanup is necessary and causes no disruption to the industry. And with that, I stand for questions.
Thank you. Questions or comments for the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 2650 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman and Committee.
Thank you, Chair Lady. We are now on item number 25 on our calendar. Patiently waiting in the crowd is Leader Camper. Leader Camper, we'll call up item number 25, House Bill 1339. You are recognized. You have a motion. You have a second. You're recognized.
Thank you, Mr. Chairman and Committee. Mr. Chairman, this bill was brought to me by Senator Yarborough. He's been working with the Department of Human Services to craft an amendment that would make this a bill, something that they feel comfortable implementing. Unfortunately, my amendment was not timely filed. But I noticed your final calendar, and what I hope is that we could put the amendment, we can accept the untimely filed amendment, put it on so that once we get to full committee, that we're actually considering the amended bill versus having to amend it there. I don't know if you have a copy of it, or I can give you the drafting code.
And Leader, thank you very much. This was given to us a few hours ago by your office, and thank you very much. It is going to be deemed untimely. Is it drafting code 017098?
It is, yes, sir.
And I know you've waited patiently in the audience. Thank you very much.
Mhm.
We are rolling several bills to the heel with a hard stop at 5 o'clock today, and we are 100% guaranteed that we are going to be meeting next Tuesday. If we were to roll this bill to the heel, the amendment at that time will be timely filed, and we'll be able to consider as that time. Is that,
Oh, yeah.
would that be
works.
acceptable to
Yes,
you, Leader?
yes, Mr. Chairman, that works.
Okay. All right. Without objection, item number 25, House Bill 1339 by Leader Camper will be rolled to the heel without objection.
Thank you, Mr. Chairman, committee.
And thank you for your
Appreciate it.
patience very much. We're now going forward. Item number 27, we'll dispose of a couple of things as we're moving forward here. Item number 26, House Bill 2727 by Chairman Faison. The request has been to take that bill off notice. House Bill 2727 by Chairman Faison without objection off notice. We are now on item number 27. Let me make sure I get my numbers straight. Item number 27, House Bill 2720 by Chairman Garrett, Representative Garrett. Item 27, House Bill 2720. The request has been to roll this bill to the heel. Without objection, bill is rolled to the heel. We have also item number 28, House Bill 2555 by Representative Shaw. The request has been to take this bill off notice. Item number 28, House Bill 2555 by Representative Shaw, off notice without objection. We do see Representative Lynn is in the room. And we have Representative Lynn, and we've got about 75 seconds, and you've got two bills. So I'm going to, without objection, we're going to go to item number 39 on our calendars. Am I missing any members in the audience? Any legislative members? Throw your hands up in the air and wave it like you just don't care. Do not see any. We're going to item number 39 on our calendars. If you're looking at the dashboard, item number 39 is House Bill 2524. You have a motion, you have a second. You recognize Representative Lynn.
Thank you so much, Mr. Chairman. This is a bill that would name October 9th as Pandas Awareness Day to promote awareness of pediatric autoimmune neuropsychiatric disorders associated with the streptococcal infection and pediatric acute onset neuropsychiatric syndrome. Couldn't believe I could say all that.
Question has been called. Thank you very much, and we'll give you much more time in full committee to have that discussion. All in favor of sending House Bill 2524 to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward. We are now on item number 40 on our calendars. You have a motion, you have a second. We have an HJR 855 by Representative Lynn. I think you do have some amendatory language on this.
I do, sir. This has an amendment. It's 016537.
You've heard the drafting code for the amendment number one. You have a motion, you have a second. Let's go ahead and place the amendment on the bill. All those in favor of placing amendment drafting code 016537, please signify by saying aye. Aye. Any opposed, please say no. Your resolution is amended, and you recognize on House Joint Resolution 855 for about 30 seconds. You're recognized, Chair Lady.
I'll try to hurry. This resolution encourages Tennesseans to eat healthfully by watching how many simple carbohydrates, sugars, and seed oils that they consume, because all three of those are such a combination really affect health.
Thank you. Any questions or comments? Question has been called. All those in favor of sending House Joint Resolution 855 as amended to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. House Joint Resolution 855 moves forward.
Thank you, sir.
Thank you very much. Ladies and gentlemen, we have hit the hard stop on this particular committee, and all right. The bills that have not been taken up on this calendar will be rolled to the next meeting, which we will continue to have at our regular time and regular place on Tuesdays. All the bills not taken up, once again, I'll remind you, we are on our final calendar. All of these bills will be taken up in our next committee meeting, the same time and same location as when the priors were. Without objection, we are adjourned.